This is Outside Source on BBC News for viewers in the UK and around the world. We are covering all the very latest coronavirus developments here in Britain and also globally. Our headlines: the start of the first human trials of a coronavirus vaccine in Europe. Hundreds of volunteers will get the vaccine. 2 of them were injected today in Oxford. Unemployment in the United States hits more than 26 million as another 4.4 million people claim benefits in the last week. EU leaders discuss a massive coronavirus bailout as the European Central Bank warns the bloc's GDP could fall by 15%. And the weekly clap for carers around the UK as millions show their support and gratitude for Britain's coronavirus first responders. Hello and a warm welcome. We will bring you the updates on the coronavirus pandemic across the world, but we will start here in the UK, where the first human trial of a coronavirus vaccine in Europe has begun. However, experts are sceptical that anything will be widely available before the end of the year. Nonetheless, though, the simple injection in a laboratory in Oxford marks a significant moment in the scientific response to the COVID-19 pandemic. Our medical correspondent, Fergus Walsh, has this special report.
What would normally take years has been done in 3 months by scientists at Oxford University. Around 80 groups worldwide are developing coronavirus vaccines. A few others in the US and China have also started human trials. There's no guarantee any of them will succeed.
Personally, I'm very optimistic it's going to work. Formally, we are testing it in an efficacy study. There's absolutely no suggestion we're going to start using this vaccine in a wider population before we've demonstrated that it actually works and stops getting people infected with coronavirus.
So how does the vaccine work? Scientists have taken the genes for the spike protein on the surface of coronavirus and put them into a harmless virus. This forms the vaccine. After it's injected, the vaccine enters cells which start to produce the coronavirus spike protein. This prompts the immune system to produce antibodies and activate killer T cells, which should recognize the coronavirus in future and destroy it, preventing infection. The scientists will only know how effective the vaccine is if lots of volunteers are exposed to coronavirus.
Well, at this moment, we're chasing the end of this current epidemic wave. And of course, if we don't catch that, we won't be able to tell whether the vaccine works in the next few months. But we do expect that there will be more cases in the future because this virus hasn't gone away.
Local healthcare workers are being recruited to the trial as they have a higher chance than most of getting exposed to coronavirus. The Oxford team are hoping to have 1 million doses of vaccine ready by September, with a huge scale-up in manufacturing after that. It's not clear, though, who would be prioritised to get the vaccine first. And for now, we have to wait and see if it works.
Yes, we have to wait, but a little bit of hope there. Now, let's bring you up to date with the figures for the UK. The country has reported another 616 coronavirus deaths in hospital. This now brings the total to 18,738. That does not include, however, deaths in care homes or, in fact, in the community. So in the daily press conference, the Health Secretary also announced an expansion of testing and tracing people with coronavirus. Essential workers and people who live with them will now be able to be tested. So let's hear from Matt Hancock.
We can make it easier, faster and simpler for any essential worker in England who needs a test to get a test. From today, employers of essential workers who will be able to go on gov.uk to get a test for any of their staff.
Now, the government has set a target of 100,000 tests a day by the end of the month. So let's check out how they're delivering. Well, this graph shows the capacity to test has, in fact, there it goes. It has increased to 51,000 per day. And Mr. Hancock says that it is on track to reach that 100,000 target. But while the capacity is up, only just over 23,500 tests took place yesterday. So as you can see, there's still some way to to go. The government is also hiring 18,000 people and developing an app to help trace infections. But Mr. Hancock says that doesn't mean that there is a deadline for reducing the current social distancing measures.
What I would say is that test, track and trace can, done effectively, can help to suppress the transmission in a way that allows you then to have lesser social distancing rules. And critically, test, track and trace works more effectively when the rate of new cases is lower. So the lower the rate of new cases, the more effectively you can keep it down using test, track and trace rather than having to use heavier social distancing measures.
So can the UK government reach its target? Well, here's our political correspondent, Jessica Barker.
Two elements to this testing target, and it seems to me they're pretty confident in terms of reaching capacity. So as you've been reflecting, now at around 51,000 tests in terms of capacity, therefore the ability to carry out, the availability to carry out around 50,000 tests a day. But as you also mentioned, the actual numbers of tests being carried out in reality much lower than that, 23,560, the latest figures I have. So they seem like they can get to that 100,000 capacity figure, but of course they want to make sure that that capacity is being used, and that is what's behind, I think, trying to expand the eligibility of those who can take part in tests. Although I think ministers would say that they always intended to try and expand testing. The priority at first was patients in hospitals, then key workers, and now they're making it easier to allow key workers via their employers or key workers themselves from tomorrow to sign up and try and get a test. All to reach, I think, this target of 100,000 by the end of this month. And that was a target that Matt Hancock, the Health Secretary, set when the government was coming under quite a lot of pressure over its strategy when it came to testing. You'll remember, it's very well known now, when last month the WHO, the World Health Organization, said test, test, test. And it led to questions here and some criticism as to whether the government was doing enough. Now, the government said that it's been led by the science, that it has taken the right steps at the right time. But Matt Hancock did announce that target whilst he was under some pressure, and now clearly under some pressure to meet that within 7 days.
And of course, if that happens, we'll keep you posted. So that's the situation in the UK. Let's turn to the US now. The US House of Representatives is meeting to vote on another tranche of bailout funds as a further 4.4 million Americans lost their jobs. Well, the latest unemployment numbers are pretty stark. New applications for unemployment benefits mean the total number of people who have lost their jobs since mid-March is now 26.4 million. That is around 15% of the US workforce. And this graph shows the huge spikes in unemployment, which happened extremely quickly as those lockdown measures brought the world's biggest economy to a standstill. And this is a graph from the Economic Policy Institute. It shows us the unemployment claims over the past 50 years. And the areas, those polls that you can see in grey, they indicate a recession. And basically what this graph tells us is that the jobless claims of the last 5 weeks are in fact more than 5 times worse than the 5-week period of the Great Recession. So really putting it into context. This is really hard to comprehend figures of this size. So let's get some context from the economist Elise Gould. She tweeted that how do we even understand a number like 24 million? It's as if the entire adult population of Texas and Oklahoma combined applied for unemployment insurance benefits in the last 5 weeks. Extraordinary figures. Well, to explain how quickly individuals will be able to access the financial aid, here's Heidi Shear-Holes, a former chief economist at the Department of Labour.
Our unemployment insurance program is actually administered at the state level. So there's more than 50 of these programs, and they have varying degrees of being ready to accommodate a crisis of this magnitude. So what we're seeing is, in many cases, people are getting frozen out. They're having to face long delays, which is a real problem. I hope the U.S. really learns the lesson that we need to invest more in these programs so that we're ready when a crisis like this hits, because this is the lifeline for working people who have lost their jobs through no fault of their own, through a global pandemic. And so we really, it is a shame, I think, the fact that we've underinvested in these systems in recent decades. It's working people right now who are paying the price.
And it's working people, especially people who work in, say, the services industries, those people who serve food, for example, people who earn such a large amount of their salary through tips that will be hugely affected.
Yeah, so the industries that we're seeing being hit hardest right in the beginning of this crisis are those frontline service industries where there's a lot of social interactions that have been really shut down. So you're talking restaurants, hospitality industries, hotels, tourism, anything related to events. Brick and mortar retail has been hit really hard. So one of the underlying things about all those is many of those jobs are very low wage jobs. So you're seeing people seeing their jobs disappear who before that didn't have high enough wages in order to have a cushion built up. So people really are in dire straits and desperately need government relief at this point.
So the House of Representatives is meeting to approve the latest relief package. It's worth $484 billion. It's nearly 2/3 of it is being earmarked to help small businesses cope during the pandemic. Let's get Catty Kay's perspective on this. She joins us live. And that is really needed because we saw just within 2 weeks the money spent completely on the small business relief fund. So the money is desperately, desperately needed.
Yeah, so you showed those charts showing the unemployment, and it's really been the last 5 weeks, hasn't it, Kasia, that we've seen this huge spike week on week of millions of Americans losing their jobs. Now, if you think about it, that money that was destined for small businesses, all of that in the first round of stimulus went in 2 weeks. So for 5 weeks, some Americans have not been getting any money at all. They can't pay their employees, they can't pay their rent, they can't keep their businesses going. So they're looking to this new tranche that the House of Representatives is about to vote on, $484 billion in a new stimulus program, $60 billion of that reserved specifically for the smallest businesses in the country. Because what happened last time around is that some of the money actually went to bigger businesses who could actually go to a bank, who had the resources to go to a bank and get loans of other sorts. And there's been a lot of controversy here about that. Were the most needy really getting the money? So Congress has tried this time around to do a better job of earmarking some of this money specifically for small businesses. It'll go through Congress, and in the times we are in, even the voting for it is going to be different, because usually this would be a 15-minute vote. All of the 435 members of the House of Representatives would come in, cast their ballots, it would be done. This time around, only 60 members of Congress at any one time can be in the chamber. And afterwards, there has to be a disinfecting process. The whole thing's going to take about 2 hours. But we do expect the House of Representatives to vote on this later this afternoon.
Yes, of course, we'll update our viewers as and when that does come in finally. Stay right there, Catty, because I want to touch on another story coming out of the US. It involves President Trump. Now, we've heard Donald Trump repeatedly promise to reopen the economy in weeks, not months, even as coronavirus deaths continue to mount. So perhaps it might be surprising to hear his message for Georgia's governor, who has started to lift lockdown restrictions.
They can wait a little bit longer, just a little bit, not much, because safety has to predominate. We have to have that. So I told the governor very simply that I disagree with his decision, but he has to do what he thinks is right.
So as you can hear, a rather different tone to what we've heard previously from the president. Well, Georgia's Republican Governor Brian Kemp hit back on Twitter, tweeting, "I appreciate the president's bold leadership and insight during these difficult times. Our next measured step is driven by data and guided by state public health officials. We'll continue with this approach to protect the lives and livelihoods of all Georgians." Well, Georgia's move is the most aggressive of the states. From Friday, nail salons, massage parlours, even bowling alleys and gyms can reopen, while in-dining restaurants will be reopened on Monday. So, Catty, we can see that it will be helpful, of course, for the economy of Georgia, but it just goes to show what a difference across different states the whole lockdown process has been.
Yeah, I mean, the data that Governor Kemp is referring to is data suggesting that Georgia hit its peak a couple of weeks ago in terms of the number of coronavirus cases. And so he feels that he can take these measures in order to try to reopen the economy, bearing in mind how many people have lost their jobs. But we're already hearing business owners from Georgia, owners of gyms, for example, saying they're not even going to bother reopening because they don't think it's safe and because polls show that the public doesn't think it's safe. And so will they actually go back, even if a nail salon is opened in Atlanta, Georgia? Is somebody going to think that they can go there in a socially distanced way and get their pedicure or their manicure? It doesn't seem so. So is it worth these businesses reopening? You're right, it points to the patchwork nature of this. And yes, some states have much fewer cases, for example, than New York or Washington, D.C., where I am. And so the feeling is that they can start to reopen slowly. There's some concern that people can move between states. And so could they carry the virus with them from one state that is shut down to another that is starting to open up? But it is part of the American system. And I think this coronavirus incident, the whole pandemic, has revealed some of the weaknesses in the system where things are patchwork in this way.
Very complicated situation, extremely interesting to hear it outlined by you, Catty. As always, thank you so much for talking us through it. My colleague Catty Kay there live from Washington. Stay with us here on Outside Source. Still to come, we'll be looking at what EU leaders have been discussing. It's a massive coronavirus bailout as the European Central Bank warns that the bloc's GDP could fall by 15%.